Hi there, my name is Norm Fenn, and I am a clinical associate professor at the Manchester University College of Health Professions, Nursing, and Pharmacy, with a focus in pediatrics. That's my specialty. I did my PharmD degree at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences, where I graduated with honors. I did a PGY1 pharmacy practice residency at Children's National Medical Center in Washington, D.C., as well as a 2-year fellowship in academia and ambulatory care at Purdue University's College of Pharmacy. So the reason I picked pharmacy is I actually thought I wanted to go to med school when I started in undergrad. And after the first year of undergrad, I said, I really don't want to do med school. But I was introduced to a community pharmacy that I was working at, where I was up front originally. And because of my interest in medicine, I was able to start working in the pharmacy in the back and absolutely loved it. And from then on, I just love my career. I love working in pharmacy and every aspect of it, from taking care of patients, the medications, how they work, the interactions, why do we choose which medication, when to use it, what are the complications that we can see from that. Everything just fascinated me, and that's why I've been in pharmacy for the last 25 plus years. So right now, as I said, I'm an associate professor, and I have a 50% clinical split with the Parkview Regional Medical Center. I work at the Women's and Children's Hospital here in Fort Wayne. And so typically I either spend my day at the hospital, where I begin with pre-rounding. I go on clinical rounds with physicians, nurses, and learners and make sure we take care of patients. I also do various consults for patients, discharge, medication counseling, whatever needs to happen, as well as serving on various committees, including the Resident Advisory Committee. At the university, I have a very flexible day, so I could be working on my teaching lectures, I could be conducting research, I might be precepting API students, I might be working on some of the tracks that we have, or I might just be trying to tidy up my emails. It just depends on the day and what my workload looks like. I help with orientation, I serve on various committees, including chairing the curriculum committee, and I have so many hats that I wear as a professor, especially an associate professor. The reason I love my job in academia as faculty, it's twofold. One, I really like having something different every single day. So whether it's working at the hospital where I'm taking care of patients, whether it's working on research and writing papers and striving to learn for what's going to change and what's going to happen and what's going to influence the next generation of pharmacists, as well as mentoring and teaching students and really getting to see their aha moments. That really is the best part for me. And what advice might I have for somebody who's interested in pharmacy? It's not a one-size-fits-all. There are avenues and career paths that didn't exist that we never knew about until somebody went out and created them. And that includes something like a NASA pharmacist, which that individual's been in their role for almost 20 years or so, and they're doing things that you would never think a pharmacist would traditionally do. So really, whatever you're interested in, we can kind of find a way to make that work for you. And that's what I love about pharmacy. It's so adaptable and flexible. And maybe your ideal position isn't created yet, so you can go out there and create it up for your own. Hopefully you guys found this interesting, and please don't hesitate to reach out if you have questions.